6 years after serving as the lead technocrat in the Ministry of Health, Dr. Asuman Lukwago has resigned. Dr. Lukwago's resignation comes barely a few months to the end of his contract, which is supposed to end in January next year.
The reasons are personal, and they are related on how I'm viewing my future, and I will plan to do other things. One is that I'm a professional, I'm a physician, I'm a specialist in internal medicine. I've done a lot of work on projects, both in Uganda at an international level. So I want to explore other talents, to use my talent somewhere else.
Speaking to NTV at Nyendo in Masaka district, Dr. Asuman Lukwago told NTV that he has written to the president asking him not to renew his contract because he wants to do his personal work and also pursue his medical career.
I'm not renewing my contract, so I will just become a free citizen and work with colleagues and see what we can do. So I thought that I would not be employed by government up to beyond 50 in this form.
However, Dr. Lukwago claims his exit could as well be attributed to intrigue in the Ministry of Health.
It is one of them. I have made a judgment that if I continue to stay at the ministry, we may cause more conflicts, and then the Ugandans will not benefit from our presence. So at a certain stage, yes, you have to give way so that you don't become a source of failure. Then you pray for the team that is going to carry on the jobs of making sure that the health of Uganda is well catered for, and then you also watch from another side.
Early this month, Lukwago had suspended his undersecretary, Ronald Segawa Jagenda, faced a backlash when the head of public service, the IGG and the secretary to the treasury revoked his decision. His relationship with the health minister, Dr. Ruth Acheng, according to highly pressed sources at the ministry, was frosty.
In fact, the decision for me to leave, not to renew my contract, is purely from myself, but after observation. So I will thank my employers because they haven't told me you leave.
He accused some of the senior technocrats at the Ministry of Health he declined to name of being vultures spending taxpayers' money on trips abroad for their personal benefits.
Waliwo abantu bafe abaagala okweteekako akabubi ka ssukaali bawomerere naye munganda bakaawu ffe sijabagaana lwakuba ogwo si mulimu gwaffe kubaatula naye bonze kye bamanyi obubbi bwe balina bujja kulabika mangu nnyo. Abalimba nga bagamba nti bakozi ba mirimu nga babeera ku nnyonyi bajja kulabika era seera buva ku nnyonyi ssaawa 6 ez'olwaleero kawungezi ssaawa 5 ogenda ku nnyonyi ebyo byonna bijja kulabika.
However, early this year, court ordered for the arrest of Lukwago over allegations of fraudulent transfer of 1.2 billion Uganda shillings to the National Medical Stores account. NTV has learned that the president, on receiving Dr. Lukwago's resignation letter, has nominated Dr. Diana Atwine amongst those likely to replace the outgoing permanent secretary. Atwine has been working as the head of Health Monitoring Unit in State House and the president's personal physician. Jingo Francis, NTV.